Gen X is seeing a resurgence of some cancers and an increase in cancer that were fairly rare. Why is that? This comes from a recent report out of Lancet magazine that you can see here. It turns out that there are a number of cancers that Gen Xers are getting. Now, why are they getting that increased risk of cancer? There's a couple of factors. Number one is obesity. There's a rise in obesity among Gen Xers, and that rise in obesity has led to a rise of cancers. Now remember, getting cancer isn't something that just happens because you're exposed to something one day and the next day you get cancer. It typically is what they were exposed to as kids. So one of the things that we think about is the microbiome. And the microbiome among Gen Xers, particularly among those who are obese, is clearly different. And that may lead to a rise of some of the intestinal cancers that we see. Obesity is still the number 2 cause of cancer after smoking. And yes, it seems strange that smoking is still the number 1 cause of cancer, but that shows you how bad smoking and vaping is. And Gen Xers seem to be immune from some of the discussions that we have had about cancer because they're smoking at a higher rate than even the baby boomers are. So what can we do? Number 1, decreasing your risk of obesity is certainly helpful, especially among kids. So what this means is when they started analyzing the diets, we have to have diets that have less saturated fat, less meat, less refined grains, more fiber, more fruits, more vegetables, more legumes. A Mediterranean-style eating pattern. I will list the different types of cancers in the comments below, but it is rather strange to see certain cancers on the rise again, but clearly we see a lot of those are diet-related. And don't believe the strong guys with the big abdominal muscles saying that their diet is perfect. It's not. That has led to an increasing rise in colorectal cancer, which has previously been declining. One thing that seems interesting is while we're seeing an increased number of cancers, we're actually seeing a decreased number of cancer deaths. Part of this is because when we can diagnose the tumors earlier, we can typically save more people than when we diagnose them later. Our diagnostic methods have gotten better. Now, unfortunately, you can't go in and get a screen for every type of cancer there is. We don't have those yet. But certainly when you feel unwell, you should see your doctor and they will do a thorough examination and do any lab tests that might lead them to believe it. And finally, if there are genetics in your family leading to cancer, you can see a medical geneticist and get tested to see if you have any genes that might lead you to cancer. Until then, stop smoking, stop drinking, and eat better. If you like this information, like, follow, share.